Hello everyone. So today our topic of discussion is infant of diabetic mothers. So let's discuss this topic. The term is referred to a baby whose mother has diabetes that can either be pre-gestational, means it is before pregnancy is even started, or it is gestational diabetes, that is that happens within pregnancy. Mother whose blood glucose levels are not well controlled during pregnancy, that can be either due to poor diet, poor lifestyle, or insulin non-compliance, can have high glucose levels during pregnancy that result in complications in the newborn. So, what are the four complications that can occur in newborn? That includes hypoglycemia, cardiovascular abnormalities, dyspnea, macrosomia. So let's first discuss the hypoglycemia. That is the most important and the life-threatening complication that can occur in ITM. So, it occurs during pregnancy because the neonate is exposed to high blood glucose levels, so it starts making more insulin. Immediately after delivery, the boy is still producing high amounts of insulin, but the mother's glucose is absent now, so the high amounts of insulin causes hypoglycemia. For this purpose, we make glucose monitoring chart and mother monitor the baby's glucose closely. In babies, the glucose is checked by heel stick method. It's not the conventional method that occurs in adults, it's the heel stick method. IV glucose is given as treatment and the baby is kept under observation for 48 hours. Unless for the 48 hours the glucose levels are normal, you will not discharge the baby. So the other comes the cardiovascular abnormalities. They are very common in IDM, therefore a careful chest examination is done and an echocardiography is ordered in all cases. So the reason is that in utero during the first trimester, neonate's heart is exposed to high amounts of insulin. So that high amounts of insulin causes the birth defects that include VSD, HUCM, also called hypertrophic cardiomyopathy, and aortic stenosis. So this is important for the exam point of view that the three conditions that are caused by IDM are VSD, hypertrophic cardiomyopathy, and aortic stenosis. Other defects that can be seen include TGA, truncus arteriosus, and double outlet right ventricle. So intervention is done according to the type of defect that you will see on echocardiogram. The other complication comes is dyspnea. In dyspnea, we need to keep a track on unit's respiratory rate, and here you will also make a chart and you will closely monitor its respiratory rate. As IDM have immature lungs, due to decreased surfactant production that is also caused by high insulin levels. So here also the defect is caused by high insulin levels that is decreasing the surfactant production. Other complication comes macrosomia, that is again due to high insulin production in the IDMs. It can result in birth defects and birth injuries like shoulder dystocia, clavicular fracture, Erb's palsy, and Klumpke's palsy. So now we have covered these four complications. Now come at the treatment of IDM. In treatment, it depends upon complication that is arising in the neonate. So it was a very important topic, and the most important questions that are clinically important are hypoglycemia. That you must know that the child can go in hypoglycemia, and you will monitor their glucose at regular intervals. And for exam point of view, the birth defects that are important are VST, hypertrophic cardiomyopathy, and aortic stenosis. So you have a good day. It's Dr. Yumna Riaz. Please like, subscribe, and share. Thank you so much.